Uh, Thank you both for this opportunity. I realize I'm the last person standing between the chair and the hotel bar, so we will get through this. So I have no commercial disclosures, but do have some research that will describe some of the work here. So what is health literacy? The National Academy of Medicine defines it as such. It is the degree to which you as a person can obtain, process, and understand information to make decisions and go through the healthcare system. So this pervades everything. You think about you as a patient, your family, your friend. When you go through the healthcare system, you have to do a bit of all of this to successfully get through that journey. And so health literacy really infuses everything that we do in our interactions with the healthcare system. If we think about surgery and the surgery journey, this is also important because at every touch point that we have in surgery, you have to do something about understanding what's going on to have the best chance of a successful outcome. And so the other important thing, though, is that as surgeons, we tend to say things to patients, and we assume that it's all understood. But in reality, I would argue that actually most of the time, patients have no idea what we're saying to them, whether it's ourselves as a provider or as the institution in terms of instructions that they give to a patient. So why is this important? Is this really a problem? Yes, it is. The biggest survey on health literacy that's still cited was in 2003, when they went around the country in the US and basically measured literacy, including health. And this is the proportions of health literacy that they saw in this cohort. So basically in green, 12%, these are individuals who can calculate a deductible, okay? And everything else there, as you can see in the red, at 14%, are patients who can maybe circle the date on the appointment slip. The overall conclusion, about 1 out of 10 persons basically has what's considered proficient health literacy. But 9 out of 10 adults have difficulty using health information. And I'm probably one of these 9 also. And you look at these maps of low health literacy across the United States, and it looks like this. Red is bad, green is good, and you can see this type of map follows a lot of health disparity maps, obesity maps, smoking maps. And so it's a problem that cuts across the entire nation and country. Now, so a lot of people have low health literacy. Does it matter in surgery? It absolutely does. You know, health literacy 2 decades ago, people have done incredible work with chronic diseases, and only in the last few years have we started linking low health literacy with surgical outcomes. And it's no surprise, this data is all coming out now. Low health literacy is associated with higher risk of readmissions, longer length of stay, more post-op complications. And a really fascinating study that just came out just a few weeks ago looking at enhanced recovery showed that low health literacy patients actually had the worst compliance with enhanced recovery components and then had the worst complications. So there's actually sort of a mechanism of action here in terms of why a patient with low health literacy would have poor outcomes. So my argument here is that health literacy absolutely matters. Just like it does in chronic diseases, it matters in surgery too. So how do you think about this? This is sort of the framework, the conceptual model, so to speak, that we like to harp on in research in terms of health literacy and how it links to outcomes. And just quickly walking through this, a patient comes to your clinic with a set level of health literacy, predetermined by demographic factors, social determinants of health, things that may be out of really your control in that clinic or room. But that patient with, say, low health literacy has a new ostomy, right? They're at risk of being readmitted and having problems. But this model shows you that they're not fated to have a poor outcome because there are things that you can do in the middle in that modifying factors at the healthcare system level, the provider level, and even at the patient level to change the direction of that. So you can do something at the system level with the instructions you give the patient, with the way that you speak to the patient. Those are the things that you can do to sort of change the outcome. And we bucket this model into really 2 areas. You can identify patients with limited health literacy, and then you can actually do something about it. So what about identifying patients with limited health literacy? Well, I think everyone in the room here understands and can feel this, right? You're in clinic, you're seeing a patient, and they look at you, and you walk out of that room, and you're like, that patient had no idea what I just said. And there are absolute characteristics, as shown on this list, of patients with limited health literacy. Patients don't ask questions. They want to get out of that room as soon as possible, right? But no one wants to look or act dumb. So that's what's going on. And so we have to be cognizant of this and recognize that, again, 9 out of 10 adults have difficulty using health information. All right, so you have patients with limited health literacy. What can you do about it? So what about the system level? So let's talk about written communication. We all get a stack of papers when we go to the doctors. So what about readability? And this is something that many in the room probably know already, but the NIH and the AMA recommend 6th grade reading level for all materials. If we look at my own house here at UAB, at our readability of materials in all these surgical specialties, nothing is actually below the 6th grade reading level. And in fact, there are certain specialties, including my own in colorectal, where we have nothing written at the recommended reading level. So this is eye-opening, at least for our institution. And so it really gave us the motivation to try to do something about it. And you can, okay? This is no rocket science here. There are things that you can do using best practices from graphic design, information design, you name it, where you can take existing stuff, version 1, right? Usually this is material that you wrote in your office that you thought was awesome, but then you realize it actually is completely unreadable, and you can convert it to version 4. And you can improve the material by measurements. You can engage with patients to actually talk to patients and say, does this actually make sense? And you can make it more understandable. And patients really appreciate this. One of the themes that you see here is that it has moved from text-based to visual. And the visual piece is super important, right? This is another example of taking the scribbles that surgeons do on pieces of paper, which work, but you can take it to another level too, with graphic artists, in this case, that's my sister-in-law who was a cartoonist for Marvel Comics, but she converted it to basically those plan A, B, and C for colon reconstruction. And patients prefer this. Dr. Morris, one of my colleagues, did a really interesting study looking at visual consent. So when you consent a patient, right, you give them a stack of paper, 10-point font, they can't read anything. But if you put pictures in there, it helps patients understand complications. And patients can really recall the potential issues that might happen after colon surgery. And anxiety is also reduced for patients. So that's the written stuff. What about technologies? So we've talked a little bit about technologies just earlier, and they're great, right? Many of us have phones. Technologies like this are here to stay. But I think one of the big strengths of these technologies is the education piece. Right? You can take education such as how do you prep your colon before surgery? How do you empty your pouch? Make it cartoon-like, use visual pictures, step by step. This really connects with patients, and they can really understand how to do something. Dr. Lawrence Lee just published this paper looking at, again, these type of technologies, and basically patients truly do love this, right? They really feel like they can communicate with the team, and they can understand the issues at hand. So what about provider level? So providers are incredibly important. You, as the person in the clinic room interacting with the patient verbally, orally, it is a critical piece of any encounter. And does it matter? Yes, because verbal communication is something that's perhaps underappreciated, right? Who actually watches you actually talk to the patient after medical school? No one. So we asked the question, well, so how do we do? What's the quality of our talk, or our speech with patients? And this is just an example of 4 surgeons in our institution. I won't name who's who, but you can see normal conversation has a speech rate of about 120 to 140 words a minute. We all speak way faster. We're close, all over the place. Why does that matter? Because the faster you speak, the less understandable your words are, all right? And so this is something that's well observed and speech coaches will tell you this all the time, and it's absolutely true within our clinical encounters in the surgery clinics. And not only that, but in the red there, patients with limited health literacy, they have the shortest clinic visit on top of this. And they don't understand as well what happened after that appointment. And so you sort of have this double whammy effect. You got patients with limited health literacy, they have the shortest clinic visit, they don't understand, and surgeons are speaking like micro machine speed to them, and you can't understand. So it's no wonder that patients with limited health literacy have difficulty understanding. And again, this is no rocket science here. There are well-established ways to communicate better, right? Using the teach-back method, which is probably a huge thing that we try to emphasize. You don't ask these questions. You ask, at the end of the visit, you can say, what questions do you have, right? Instead of asking, do you have any questions? Because the answer is going to be no. So you ask, what questions? Slow down, and plain language, pictures, teaching tools, okay? These are all things that can be used. So I think, hopefully that just gives you a little bit of a preview of what are the things that I think you can do immediately to improve communication with patients and to really address the issue of limited health literacy. And ultimately, though, it is going to be multi-level interventions across all of these spaces to really make the ultimate difference. And so our vision within our lab is ultimately to think about the spectrum of surgical care and really to equip each of these points of action with these best practices in health literacy. So in summary, low health literacy is very common, including in our surgical populations. It is clearly linked to outcomes and experiences. These are three things that I think hopefully you can take away just from this talk that you could probably start doing immediately in your clinic. And it does matter, and I think you'll hear more about health literacy down the road. So with that, thank you, and happy to take any questions and email me too. So, great.
Stay up for discussion.